or spirometer lung volume graph would look like. So what do you have here? Well, notice you have all these waves, and what volume is it talking about? It's talking about the volume inside of your lungs. So here I have many volumes and all these capacities. So here we have a typical average value for these volumes. Now, do I want you to memorize these numbers exactly? No, but you should know how you derive these numbers. So here we have tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. So what are the definitions behind each of these volumes? So tidal volume, so sometimes you might see two, I've seen them used in multiple textbooks, both TV or VT. Either way, they're tidal volume. So this is the volume that moves in and out of your lungs during quiet breathing. So this is roughly equal in women and men, so about half a liter. And inspiratory reserve volume. So whenever you have a reserve, it's kind of like say you have or like my mom was in the Air Force Reserve. That's like our additional Air Force personnel. Or if you have money reserves, it's how much more money you have in addition to what you usually spend. So reserves are something how much more you can do something, how much you have as backup. So inspiratory reserve volume, this is during forced breathing rather than during quiet breathing and tidal volume. So instead of being how much you inspire during quiet breathing, it's how much more you can breathe in. So again, reserve is how much more you can do something. Now expiratory reserve volume, it's also forced breathing, but instead of being the breathing out and expiration during tidal volume, it's how much more air you can breathe out compared to your tidal volume. And residual volume, this is what air you can't breathe out. So when even if you do a full exhalation, if you exhale as much as you can and try to blow out all the air in your lungs, there's still some air in your lungs, and that air that you can't push out, that's residual volume. And why do you have some residual volume? Again, those alveoli. If you didn't have residual volume, then your alveoli would completely collapse. That's zero volume in your alveoli. So there's always, even if your alveoli are being forced to, like the pressure is increasing and they're decreasing in volume, there's always some volume in your alveoli. They never fully collapse. Otherwise you have a pneumothorax. Alright, so then these are the volumes. And what do you notice about them? Tidal volume, inspiratory reserve, expiratory reserve, and residual volume. They do not overlap. The border of one is the border of another. So lung volumes do not overlap. Tidal volume does not overlap with expiratory reserve volume. It does not overlap with inspiratory reserve volume. So lung volumes and capacities, the thing about lung volumes, they do not overlap. But lung capacities, they always involve the addition of two or more of these volumes. So lung capacities can overlap, but lung volumes do not. So again, what do we have here? So again, during quiet breathing, every time you breathe in, increasing the volume inside your lungs, so that means the graph will go up. Every time this falls, what happens? A decrease in volume, that means you're breathing out. So what we have here, just small breathing in, out. So this is your tidal volume. Again, this is the normal volume of air that moves in and out of your lungs when you're not really thinking about it. So what do we have here? So what did they do in this blue part right here? Well, you notice that the volume inside the lungs had a sharp increase. So what happened here? This right here is your inspiratory reserve volume. So this increase, not only, so they were doing tidal volume, they were doing quiet breathing, then they took in a big deep breath, causing a big jump in the volume and increase in the volume of their lungs. So this is how much more this person could fill their lungs. This is their inspiratory reserve volume. So remember, this is the maximum, or actually the peak they did during tidal volume. So this is how much their lungs inflate after inspiration during quiet breathing. But this is inspiration during forced breathing. So it's how much more they can breathe in. So whenever you're measuring inspiratory reserve volume, a common mistake is measuring from here. But you actually measure from peak to peak. You never measure from valley to peak. So the inspiratory reserve volume is peak to peak. is how much more you can breathe in. Now, what's happening here? A decrease in volumes, but it's a decrease below their normal tidal breathing, right? So this is their expiratory reserve volume. So remember, this part right here is how much or their local minimum or the volume in their lungs left after they did a quiet breath, but they pushed out a little more air when they actually did that forced exhalation. So what do you notice compared to inspiratory reserve volume? Instead of measuring from peak to peak, notice that it's volume to or valley to valley. So why? Again, it's how much more you can breathe out. So this is using your accessory respiratory muscles to push out more air than normal. So again, spirometry, easy way to measure lung function without actually needing to probe and do invasive procedures on a patient. But it estimates lung size. Why? Because again, when your alveoli deflate, they don't deflate completely. So the residual volume, when you do a forced exhalation, you're exhaling a lot of air, but it doesn't exhale all the air in your lungs. Why? Then you would have a double pneumothorax if you could fully deflate your lungs. So this part right here, the residual volume, that's the part you can't deflate. And this is the down or disadvantage of spirometry. Spirometry can't actually measure your residual volume because that would require your lungs to collapse. So most of the time when you have spirometry, it's estimating your residual volume based on your height, your sex, or other parameters. Now, instead of volume, remember volumes don't overlap, but now what do you notice about the capacities? Well, one, they're all generally bigger. And why are they bigger? Well, they all involve the addition of these volumes. So lung capacities, you have vital capacity, which is you sum up the inspiratory reserve volume, your tidal volume, and expiratory reserve volume. Or there's another way. I like using it this way. You take your total lung capacity, so your total volume minus your residual volume. Your inspiratory capacity, how do you measure that? So it's just your tidal volume plus your inspiratory reserve volume. So don't get those two confused. And then you have functional residual capacity. This is your, so you have many lung capacities. So if I do test you on this, especially for the multiple choice, I probably will test you on vital capacity and total lung capacity. Maybe if you're doing an exercise study or a lung physiology study, you might measure the others. But vital capacity and total lung capacity, these are pretty useful clinical application measurements. So how do you measure that? So what happened here? Well, what happened with the blue curve? Well, again, when you have increase in volume, what's happening here? They're doing quiet breathing, and then they took in a big, deep breaths again, and then blew out right here. They blew out all the air they could, and then went back, resumed normal breathing. So this is, if you took the lab, this is what you did during those tests. You took a huge breath in to increase your lung volume, then you took a huge breath and tried to expel as much air as you could, and then you resumed normal breathing. So vital capacity, so this is how you measure it. You just take the extreme peak and subtract it from, or subtract the valley from that extreme peak. So I guess the difference between the maximum you can breathe in and the maximum you can breathe out. Or you can also calculate as inspiratory reserve volume plus tidal volume plus expiratory reserve volume. I prefer just taking the maximum versus the minimum, but hey, they both end up with the same number either way. So this, either way, you get the vital capacity. Now total lung capacity and residual volume, this is the way I like to measure it. So I don't like to add those three numbers. I just like to do simple subtraction and boom, I have my vital capacity from that graph. Now total lung capacity, so this is the total volume inside your alveoli and lungs. So this is your residual volume. So total lung capacity compared to vital capacity, you just add residual volume to your vital capacity. So total lung capacity, what do you notice? Well, it's also equal to the maximum volume you had during breathing in, forced breath inhalation. So total lung capacity, you can just look at this extreme maximum and you have it. Okay, so I have been, for simplicity's sake, I've been only showing the male typical pulmonary volumes and capacities, but here we have male and female volumes and capacities. What do you notice? Well, notice that the males always have, or and in terms of like these average values, all these volumes except for tidal volume is greater. So why is that? Is this one of these biases in sciences? No, well, this is why. Why the difference in lung capacity? It's all due to volume. So on average, who tends to be tall or who tends to be bigger and taller? Right, men tend to be on average taller, so this is why they also have increased lung capacity. As you have an increased height, you have increased your rib cage also has an increased size. So larger size means larger volume overall. So taller people have more lung capacity. So even though like I'm a guy, say we have a 6 foot Rainbow Vahine volleyball player, she's going to have a larger lung capacity than I am because I'm only 5'6". But if she's 6 foot tall, yeah, just by being taller, she's going to have a larger lungs and therefore bigger lung capacity. Yeah, and have you ever noticed, like, have you ever, like, talked to someone on the phone, or you've seen someone, and then when they're interviewing, you're like, oh, that's not how I expected their voice to sound. So this is a funny thing, like, even just your height, this is showing how much it affects your voice, and also the tone of your voice. So the funny thing is that this study actually asked people to talk to someone on the phone and guess how tall they were, and people were pretty accurate. So lung capacity and height, and there is a correlation. So other things affecting lung capacity. So if you're short, does that mean you have a low your lung capacity? Well, not necessarily. So things like environment, altitude, pollution, disease, things that kind of can affect your health of your lungs, that can also affect your lung capacity. Fitness as well. If you're using your lungs a lot if doing exercise, well, you're also going to increase your lung capacity as well. Why? By exercising the muscles that affect your breathing and pulmonary ventilation, you can actually expand your rib cage and also have greater control of your inhalation and exhalation. So again, this guy, so here we have this guy, and say we have her. Who's going to have the bigger lung capacity? Yeah, who seems to have the bigger rib cage? Yeah, so again, fitness does increase your rib cage size, and it also increases your respiratory control as well. So fitness can increase your lung capacity. Yep, so she probably has a better lung capacity. And vocal training and breath control. So the thing is that if you're actually a singer, so it was really funny, maybe like, I think 2 years ago, there was this girl, and she was like maybe, I would say 5'2", 5'3", but she beat the volleyball players in her total lung capacity. And then I'm like, oh, do you exercise? And I'm like, oh, I exercise, but I also do a lot of singing. And I'm like, oh, she says she could sing Whitney Houston. And I'm like, oh, she can belt out. So would she have a greater lung capacity? Well, again, if she's a great singer and she can really belt out her songs, she probably has really good, she's probably has a really great ability to inflate her lungs and also use the muscles that help in breathing as well. So again, all of these can affect lung capacity, not just height.